So just some last minute preparation tips. And look, if this is the first study that you're doing, please don't panic just because I've said all these things about needing to be well prepared. If you've already signed up to SIT in February, I'm not sure if it's too late to cancel or not, but I think 30 days is the limit, so you have to do it now. And I think these are some takeaway tips if you are and you're just starting to study. Definitely prepare a study plan so that you're realistic with your goals over the next few weeks. And in that study plan, recognise the weakest areas you have and make these a definite focus. So if you're doing a lot of paediatrics or a lot of palliative care, a lot of geriatrics in your day-to-day practice, even though you might not feel 100% confident in those areas, focus on something that you don't see. Focus on obstetrics or focus on men's health or rheumatology or, things that you just think you haven't seen. And I sometimes find this hard to explain to people, but I always try and recommend when people ask advice about studying is studying in the style of a KFP. I think the AKT is definitely the easier exam to pass. So if you're focusing on one technique of study, studying like you would answer a KFP is important. So I didn't give, full long KFP questions, but often there's a little bit about history, a little bit about differentials, a little bit about examination findings, investigations, and management. So when you're looking at a disease process, for example, Crohn's disease, you don't need to know necessarily which biologic agents need to be given for Crohn's disease. What you do need to know is the demographics of presentation, how it presents, the first investigations you do, clinical signs, first investigations you do, and what management can you institute as a GP. So a GP is never going to start a biologic agent, so you don't need to worry about that. And also, it's not necessarily your job to differentiate between Crohn's and, distal Crohn's and ulcerative colitis. That's the specialist's job. So when you're studying, think, do I know the presenting practice for Crohn's? Do I know the history findings? What examinations would I request? And what is my GP management? The KFP and the AKT are looking at assessing your knowledge of what you should be as a day one fellow of the College of GPs. It's not looking at the knowledge you should have 10 years into working as a GP. So they're not expecting you to have excessive depth. They're wanting you to know a little bit about everything. When you're studying, take breaks. And when you're at work, take breaks to study. I think, if you have the opportunity in your clinic to just schedule a break, a 15-minute break in the morning, a 15-minute break in the afternoon, and on those mornings, just pick out 2 or 3 things in the patients that you've seen that you want to quickly look up and check and do that in your break, and same in the afternoon. I think that's a nice and efficient way to get more study time in. If you have the luxury of having lots of time off before the exam, then definitely I can't recommend enough to make a study plan so that you sort of don't be like, oh, I'm going to do every single check article from RSMGP and then realise that there's 400 or something and get 1 week out from the exam and that's all you've done. I don't think that you will have done enough then. And I guess other thing is, as we all know, study when your brain is fresh. So if that's for you, if that's first thing in the morning before work, do that. Especially if you've got family commitments in the evenings, you've got young kids running around, or you've got to bathe and put to bed. There's no point studying after all that chaos. Try and either block some time out of work or delay going home if you can, or if you can do it first thing in the morning. Everybody's different. And I said in the last webinar a lot, if anyone was there, about getting a study group, and I would say it's probably not too late. Studying with a partner can be definitely more efficient, and it also keeps you on track, and it stops you going too deep into topics that you really don't need to know about while focusing on the big money stuff.